Good evening, ma'am. Hello, guys. With this, I would like to introduce our guest speaker, Dr. Mayurika Tyagi, a renowned pathologist, hematologist, and transfusion medicine specialist. She is experienced at setting up quality policies in blood banks and designing, formulating, and implementing standard operating procedures. She has acquired observership in St. Louis Hospital, Paris, and King's College Hospital, London. She is also a co-editor of a book titled Regenerative Medicine, Cellulose, ma'am. You may proceed with your webinar, after which we have some FAQs, which will be put forward by our fellow mates that they'd like to be answered.
Thank you, Sneh. I will just share my presentation with you all. A very good evening to all of you. And firstly, I must thank the organizers, IMA, MSN, UP, for organizing this event. And it is a great initiative on their part to organize educational activity for all the fellow students. And on the occasion of this World Blood Donor Day, they have organized this seminar, this webinar. So it's great that they have taken this initiative. So I'd like to tell you a little bit about what World Blood Donor Day is all about. And as you all know, these are difficult times of COVID-19. A lot of things are going on. So every sector in healthcare is facing their own challenges. So what are the challenges we are facing in transfusion services? I would like to discuss them with you. Okay, with that, I would continue with the presentation. So World Blood Donor Day is observed every year on 14th of June. The purpose behind this is to celebrate and promote blood donation throughout the world among the people. So the need for safe blood is universal. The blood is critical for both treatments and urgent interventions, and it can help patients suffering from life-threatening conditions live longer and with a higher quality of life. And it supports in complex medical and surgical procedures. Living product. But sadly, the access to safe blood is limited or to only few privileged people. A lot of people in this world are still do not have access to safe blood. So blood donations are needed all over the world to ensure individuals and communities and patients who are in need of blood, they have access to safe and quality assured blood and blood products in normal as well as in emergency situations. So through this campaign, I would like to request and call more and more people and young fellow students of your group of IMA and throughout the world, it should come as a campaign that you all have to become lifesavers by volunteering to donate blood regularly. And through this event, I would like to thank all the people who are already voluntary blood donors with some blood banks because they have given a life-saving gift of blood. And this is a great platform to raise the awareness and need for regular blood donations. So this year's campaign was based on Safe Blood Saves Lives.
Excuse me. I request everyone to please mute except ma'am. I request everyone to please mute themselves except ma'am.
I think the admin can mute everyone, then I will unmute myself. Or if somebody has that.
Sneha ma'am, please unmute everyone. Mute everyone. Except ma'am.
Okay, thanks, Sneh. So I was talking that this year's theme is Safe Blood Saves Life. And the idea is to more donors, give blood, and make this world a healthier place. So I would request all of you to become a blood donor today and help make the world a healthier place. With that, I would continue with the presentation. So who would have imagined that few months ago, common public would be so scared of a viral illness that they would stay in their homes and they would not even go to doctors and hospitals to get treated and just to protect themselves. In absence of adequate testing kits, adequate beds, and absence of approved medicines or vaccines, prevention has been the only solution to novel coronavirus raging throughout the world today. So the campaign is stay home, stay safe. On 11th March 2020, World Health Organization declared COVID-19 caused by SARS-CoV-2 a pandemic. So what is a pandemic? It is defined as worldwide spread of a new disease or an epidemic occurring worldwide or over a wide area crossing international boundaries and affecting a large number of people. So in 21st century, we have already seen few outbreaks of SARS in 2002, H1N1 swine flu in 2009, MERS in 2013, Ebola in 13, but H1N1 swine flu and COVID-19, they were declared pandemics. So what happened after that? The earth is closed today. The lockdowns of entire nations. So COVID-19 pandemic has already changed the world and the entire nations and lots of population are under quarantine. And we are looking at the risk of not only a serious illness, but also the economic consequences and widespread interruption of the business. This is the data I was looking in the morning. More than 78 lakh people affected worldwide with more than 4 lakh. Some cases have recovered as well, but still the active cases is 33 lakhs. So the situation is not going to end very soon. If we talk about India, there's a constant rise in the daily new cases. And currently we have had 3,21,000 cases as of today, 9,000 deaths. Although patients are recovering, but still there are situations that have to be dealt with. So the progression is still in progressing phase in India. So what happened? What did our government do? So we were also under lockdown from 22nd March 2020, and the hospital started preparing for the challenges to come. So hospitals not only has to deal with the challenge of carrying the overwhelming number of patients infected with virus causing COVID-19, but also to maintain the emergency services of patients with other medical conditions. So they had to manage both. And talking about transfusion medicine, there was a serious disruption of both demand and supply of allogenic blood. So the whole transfusion medicine department blood banks were disrupted. India has almost 3,000 licensed blood bank all over the country. They are either hospital based or they are standalone or they are associated with some trust. And they are all managed by or they come under Ministry of Health and Family Welfare, and they're licensed by FDA, Food and Drug and Cosmetic Act. And they have a capacity to store around 1,000 to 70,000 units depending on the size of blood bank. But from where does this blood comes from? It comes from voluntary and replacement donors. So the incoming of blood, the donations were stopped. So the most important challenge that blood transfusion services faced during this time and are still facing is recruitment of healthy blood donors. There are other challenges like follow-up of the donors, inventory management, staff safety, adequacy of emergency work and consumable management. But still, the most important, the major challenge remain recruitment of healthy blood donors. Blood transfusion services are also now participating in the treatment of COVID-19 patients by convalescent plasma collection from recovered patients. So I would also like to tell you a little bit about it in coming slides. So what were the issues and problems initially? The common myth was, will I get infected during blood donation? And sadly, blood is an essential medicine. It relies totally on donation by healthy donors in the community. So it was very difficult to convince people to come out of their homes, reach the blood bank, and donate blood. And initially, nobody knew what the answer to this question is. So initially, the short-lived blood products like platelets and RBCs expired, then plasma expired, and there was an interruption to the supply. All the camps were stopped. So blood banks tried to schedule some appointments, schedule some drives, but they were all failed. So the question that has to be answered is, will I get COVID-19 at a blood center? As we were advised to stay home as far as possible. So what to do? So the answer is safety first. The National Blood Transfusion Council of India, it is the main governing body which governs all the blood transfusion centers and gives them guidelines which are followed by all. They came up with the guidelines on 25th March regarding the implications of blood transfusion services and recommendations for exclusion of at-risk donors. So the challenge regarding blood donors were, there were decreased number of donors. Even the donors who agreed to donate, they had difficulty reaching the blood centers. Now we are in unlock 1, there are some movements, but initially there was complete lockdown. And of course, the fear of infection and exposure in the hospital. There were no camps, and we had issue of asymptomatic donors or false history provided by the donors. Because if somebody is coming to give blood, we have to be sure that they are completely free of infections and it is not transmitted to other patients. So the actual threat of blood supply during this coronavirus pandemic is not SARS-CoV-2 itself, but unintended consequences of social distancing on blood drives. So this is a consequence none of us thought of. To recruit healthy donors, we tried, all blood banks tried to recruit and identify repeated regular donors. We usually have their list. We tried to call them, tried to reach donors through social media platforms like Twitter, Facebook, they came in handy. And for traveling, their passes were arranged with the help of government so that they could travel from their home and reach the blood bank to donate blood. So we all needed preparedness for pandemic, which none of us were prepared for. And the deferral criteria provided by NBTC were very strictly followed. So all blood banks, they have an existing hospital infection control policies because they are under NBTC guidelines and FDA guidelines. So they follow all of this. So there are some practices which are already in place, like environment should be clean and there should be no infection. They should have infection control measures in place. Prospective donors, they must undergo eligibility screening. So their history has to be very carefully taken, including their travel history, donation history, history of contact. Prospective donors, they're expected to have no symptoms. So they should be asymptomatic, there should be no fever, no cough, no sore throat. While doing the procedure of venipuncture, the process of blood collection itself, standard precautions have to be followed. And post-donation reminder to report any symptoms after donation. So this was encouraged a lot, that if you develop any symptom within the next 14 days, please inform the blood bank again. And all these routine screening tests, which are mandatory by the government, HIV, hepatitis B, C, syphilis, and malaria, they were done prior to issue to patients. So SARS-CoV-2 or COVID-19 is highly infectious. So initially, there was an uncertain risk to blood safety. However, it belongs to the family of SARS and MERS. So during the previous outbreaks, there had been no reported case of transfusion transmissible infection. But still, it was a theoretical possibility. So it worried the blood banks. And initially, we did not know what is the level of viremia in the asymptomatic patients, whether they will be able to transmit it to the patients by blood transfusion. But now we know that asymptomatic patients' viremia is very low, and there has been no reported case of a transfusion transmissible COVID-19 patients. So additional precautions were taken to minimize the risk of transmission. But still, there is a chance of human-to-human transmission. Human-to-human means it can be from staff to donor, donor to donor, donor to staff. So a lot of precautions are taken during the process of blood donation when the donor comes, so that this human-to-human transmission does not take place. And the public confidence has to be gained to continue blood donation to support patients in need of blood transfusion. So the mission is to secure a sustainable and safe blood supply, including short-lived components, to meet the transfusion demands of certain group of patients with blood diseases, like patients of undergoing cancer treatment, thalassemia patients, organ transplant patients, emergency and trauma patients. Okay. And the objective is to restore and gain public confidence that blood donation is absolutely safe, and it is crucial for any healthcare system at any time. Then it is to minimize the risk of COVID-19 in blood donation and transfusion settings from donor and staff who can be asymptomatic. So what additional measures have been taken in these times of COVID-19? First and foremost is to ensure blood safety. So infection control measures for staff, for donors, and any accompanied person, if there are, staff is highly trained in infection control prevention, and all the equipment and environment is sanitized and kept clean or free from infection. The communication has to be meticulous to staff, donors, as well as public. So that is how you gain their confidence. So these are the guidelines issued by NBTC, which all of us are using. As there is no blood donation screening test for SARS-CoV-2 till now, blood transfusion services, they still rely on the donor deferral policies to minimize the risk of potential infected donors from entering the blood supply chain. So the donor selection criteria has to be very, very, very stringent. And it has to be explained to the donor that you have to give a proper history. If you develop any symptom, you have to come back and you have to call the blood bank to inform them. Even though there has been no reported case till now of any transfusion transmissible disease through COVID-19, but it is still a rare possibility. So the criteria suggested by NBTC was that if there is a travel history, if the donor has come in contact with some positive patient or is a close contact, then it has to be deferred for 28 days. If he was a COVID patient himself and he has recovered, then after complete recovery of virological clearance, radiological clearance, after all the evidence of disease has been recovered, then 28 days deferral period, and after that only the donor can come and donate blood. So these guidelines are very strictly followed in all the blood banks. So all prospective donors who are febrile and they have any symptom related to respiratory tract, they are advised not to enter the blood collection venues. The blood transfusion centers are green zones. They are kept free from COVID patients and COVID infections. So everybody has to be screened before they enter the blood bank, and they are advised to seek medical consultations. All healthy donors, if they are coming to blood collection centers for donation, they should wear a surgical mask. They should have their temperature checked in the beginning, and they're provided with alcohol rub to sanitize their hands. So masks should be worn at all the times. Alcohol-based hand rubs are provided at convenience centers, usually in the reception when the patient or donor is entering the facility. They are first provided with the alcohol rub. They sanitize themselves and then they enter. Donors are advised to have phone bookings, have an appointment so that they don't have to wait and prolong their stay in the blood banks. They are reminded not to come in big groups. So they should come in small groups, 1 or 2 people, not more than that. And they should avoid bringing an accompanied person. Don't bring unnecessary people to hospital to expose themselves. So now blood donors have transformed into a safe superhero with masks and sanitizers. So this is a summary of what blood donors are advised in short. They are advised to book an appointment, not come in big groups, wear masks at all time, take their temperature, and frequent use of hand rub. So, environmental cleaning. Social distancing is maintained as far as possible. Even the donor chairs are separated with the proper distance so that no two donors are in the same room at the same time. And high touch surfaces are frequently disinfected. Ventilation is maintained. Dustbins are provided for disposal of surgical masks if needed. They are provided extra masks if needed. And hand rub is freely available for everybody to use. So cleanliness is essential and all the requirements have to be followed. Strong disinfectants are used. At home, you may use a home bleach, but at hospital, we use sodium hypochlorite. And all high-touch surfaces, all equipments, whatever things which come in contact with staff or donor, it is frequently cleaned. So it should be cleaned before the blood donation process and after every donation as well. So during donation process, the staff has to wear the protective gear. They have to wear gloves, masks, if needed, eye goggles. They should use hand rub abundantly during procedure, before and after procedure. Okay, so all should have, the mask is a must. The change of bed sheets should be done very frequently. Disinfection of donor chair after every donation is done. And precautions are taken while packaging of blood and blood products. So these are the main challenges which are followed, which are faced by blood bank, that is healthy blood donors. There are some other challenges which I will go in very brief, like inventory challenges. So during lockdowns, even now, most of the OPDs are shut, surgeries are not being done. So there's increased amount of wastage of blood as well, because they have a very short life. So what is happening is the blood which is there is getting wasted. And when a patient needs blood, it is not available. So a proper inventory has to be managed. There's difficulty in transportation of blood and other products to blood centers, which is also there. And there is a fear of transfusion transmissibility, which cannot be ruled out. So the other thing is staff. So they are also people. They're also scared of infection. They also have to go back to their homes. So we have to keep them safe at all the times. As well as there's a shortage of staff, because possibly in initial days, some people in some blood banks got infected. The The staff who is living far off, they have difficulty reaching the blood center to their offices because there is no public transport available. And for COVID patients, we usually assign a designated staff for testing COVID patients. So some people have already been designated in that area, so the routine pool has shortened. There's shortage of PPE and also a little misuse of PPE by the staff. So how can we prevent all this? We have to explain them about the exposure and the risk. The training of staff is very essential in usage of PPE, hand hygiene, infection control measures, disinfection, okay, the area sterilization, all these things have to be taught to them. And the entry should be very restricted. So only specific persons should be allowed to enter blood transfusion services. And PPEs are must, so we always try to have adequate provision of PPE for our staff. So, to reduce exposure, there's restricted entry to the unauthorized personnel, and staff are kept on rotation basis. So most of the blood banks, they're currently operating at a 50% staff. So that 50% are at home. When this will go home, they will come back and action. And to reduce risk, the proper cleaning, environmental cleaning is must. And education of staff is very important. Then there are consumable challenges, like since there was lockdown, the consumables which we need, the reagents, there was a short of supply of that. The consumables which had expiry date near, they were getting expired, so there was also lots of wastage going on. So they have to be managed. What many blood centers did, they combined testing, like 2 to 3 blood centers, they would do testing at one place. They shifted to manual testing. They fixed testing days that we will do testing in 2 days or 3 days. So they will accumulate samples and try to do their testing on those days. So that is how we try to manage our consumables adequately. And if any consumable is near expiry, then it is distributed to other people to use so that it doesn't get wasted. So follow-up challenges. So in pandemics, so it is a huge challenge to get a follow-up of donors and patients as well. So all those who have donated blood and all those who have received blood, they have to be followed up. So everybody is advised that if you develop any symptom, you have to report it back to blood bank within 14 days. Okay, but in our country, the reporting rate is less than 5%. So none of the patients, none of the donors, they come back and report to blood bank. So blood bank has to be proactive in following up these patients. So we keep their phone numbers and addresses. We try to contact them and try to know their history and their well-being. And if they're okay, we are happy. And if there is anything, then it has to be reported to the government. There's a hemovigilance system. It is an online portal where all the reactions, all the problems related to blood transfusion and products, they are reported. So, talking about convalescent plasma. So as of now, no specific treatment has been proven beneficial or sure shot treatment, or studies have confirmed the treatment that this is going to treat COVID-19. No such treatment has come up. Similarly, in COVID-19 patients, convalescent plasma has been used in many countries in cases of moderate to critical conditions of SARS-CoV-2 infection, and the results were promising. So what is convalescent plasma? It is actually the plasma component of the blood of a recovered COVID patient. The patient who has COVID-19, he has recovered. Now he fits in our donor criteria. We will take blood, we will separate plasma. And that plasma is called convalescent plasma. And it is given to the patients. The idea or the science behind it is that the recovered patients, they possess antibodies to fight SARS-CoV-2 infection. So they already have antibodies. So these antibodies might be of some benefit to COVID-19 patients to whom it is transfused. So initial applications have shown promising results. So after that, American FDA approved convalescent plasma for patient-specific trials as an emergency investigational new drug category. And in India also, ICMR, Indian Council of Medical Research, it has started a multi-centric trials with multiple centers throughout India. It is called PLACID trial to use convalescent plasma for treating COVID-19 patients as a part of clinical trial. So which centers do this trial? If some patient wants to get this treatment, where should he go? Only the blood centers and hospitals which are approved by Drug Controller General of India and enrolled in ICMR trial can do this procedure. No other blood centers or hospitals are authorized to do it. So whoever is authorized can only perform this procedure. So for convalescent plasma, donors will need to meet additional requirements specific to convalescent plasma collection program. Okay, the program, the criteria of donor selection, which is there, which we usually follow, has to be there. Apart from it, these are the additional guidelines which has to be followed. The donor must be from 18 to 60 years of age. Weight should be more than 55 kgs. He should have a confirmed positive report for COVID-19 by a laboratory test. There should be 2 negative test reports by RT-PCR with a quarantine period of 14 days. And if it's not there, then 1 negative test with a quarantine period of 28 days. So if the donor fits in this criteria, then only he will be allowed to donate for convalescent plasma. The samples are taken prior to collection of plasma, 2 EDTA samples and 1 plain sample, 5 ml each. Antibody screening and blood grouping is done. If the donor has unexpected antibodies, then they are deferred. Then some tests like CBC, hemoglobin, TLC, DLC, hematocrit, platelet counts, they are also done to know the well-being of the patient. Screening for transfusion transmitted infections like HIV, hepatitis B, hepatitis C, syphilis and malaria, they are done and it should all be negative. They are done by either ELISA or nucleic acid testing. Serum protein levels are checked. It should be more than 6 grams per deciliter. And if all these things are right, then we go to the next step of collection of plasma. There are some additional tests which are suggested by ICMR, not routinely done by a lot of blood banks and hospitals because they are not easily available. One of them is titration of antibodies. They can be IgG, IgM antibodies and neutralizing antibodies. And the ICMR has also given us the number at what should be the level of these antibodies for this therapy to be effective. But this titration is not available in most of the blood centers. So what ICMR has suggested that if it cannot be done right now, you should store the plasma at minus 80 degrees Celsius and it can be tested on a later time. So does convalescent plasma does any harm to any donor? No, absolutely no. So donors, we make sure that they are healthy and the process of collection is safe. It is a 1.5 to 2 hour procedure. The blood is taken out. It is a machine in which it is centrifuged. The plasma is separated and in a bag and rest RBC and platelets, they are transfused back to the donor. So most of the times it is absolutely harmless to the donor. And for transfusion, all the guidelines which are routinely followed for the transfusion of any blood product or plasma products, it is followed for the patients as well. So they have to fit in the criteria of ICMR trial. And if they fit, then you can go forward and advise them a convalescent plasma therapy. And initial stages, it has shown promising results. But the study is still continuing and it would be too early to say that it will be a cure. So to conclude, I would say that blood transfusion services should have better strategic plan to respond to these challenges during a pandemic. A healthy donor recruitment is essential. I cannot stress this enough. A healthy donor recruitment is essential. Measures to restore and gain public and donor confidence in blood donation are extremely important, but they are not easy to achieve. And I would like to applaud all selfless healthcare workers and people who have worked hard day and night to combat COVID-19 and to keep all of us safe. All generous donors and sponsors who have worked and helped the local blood supply chain to meet patients' demands in these difficult times. And of course, the staff who has worked so hard and spared no effort to maintain the blood collection services. So with this, I would like to thank you all and say that on this World Blood Donor Day, you should all pledge to become a blood donor. Okay, become a blood donor today and help make the world a healthier place. Thank you so much.
Thank you so much, ma'am. It was a very informative presentation. Most of the queries were already answered, but there are other doubts of viewers related to general blood donation. May I put them forward?
Yeah, sure.
Um, First, there's a myth that blood group A is more prone to COVID. Is it true?
See, actually, the study, some people have started studying this. There is no proven results yet, I would say, but it is still a myth that no blood, every blood group, every one of us are at par with each other in this. If we come in contact with COVID patient aerosols, then we will all get infected. But yeah, this is suggested by some people, and few people in China, they have probably started studying this, that probably it is more effective, but we will not know until the results of their study come out. But as of now, all of us are at the same risk as other.
Okay, ma'am. Thank you, ma'am. And then there is in emergency, how much blood can a person donate in maximum?
Okay, so the usual guidelines say that we take 450 ml of blood, not more than that. So we cannot take blood more than 450 ml at one go. The other criteria that is followed is 10 ml per kg. So the volume should never be 10 ml per kg. This happens when the weight of the donor is less and we need some urgent, we have to make some changes in our protocols. For example, a donor is 45 kg and we want to have some components. It is a rare blood group. So we will try to make sure that whatever his or her weight is, we will not take more than 10 ml per kg for that. Otherwise, there will be hypovolemia and there will be chances of adverse donor reactions. And in one go, never more than 450 ml. You can donate after some time, but not more than that.
Okay, ma'am. Then there was this question: is it true that we can't donate blood after getting a tattoo?
After taking
A tattoo.
tattoo, yes. So tattoo uses needles, right? So anything which is related to needles, you have to have a deferral period. So after tattooing, the deferral period is 3 to 6 months, because this is a time you could be in a window period. So we keep this time. If somebody is in a window period, we want them to become clearly positive or negative in the test results. So that is why there is a window period for all the donors. Sorry. So yes, tattooing, it is 3 to 6 months. Anything, if you have piercing also, that also deals with needles. So anything with needles, then the deferral period is 3 to 6 months.
Okay. Then someone asks, I heard some camps sell blood, the donated blood. Is it true?
I'm unable to hear you. Sorry, can you repeat that?
Someone asked that some blood camps some blood camps sell the donated blood. Is it true?
Sell the donated blood? No, mostly it is not there because all the blood donation centers, they are under strict guidelines of government. So FDA keeps a close tab on such camps. So even if this happens and it has to be brought to their notice, and they take strict action against those blood banks. Even recently, few months back before this lockdown and all, we had two blood banks which were shut down in Noida, one in Ghaziabad itself, because they were not sure whether how their policies were. So all the policies have to be very strictly followed, and you cannot sell blood. However, government allows you to take processing charges. So processing charges includes the cost of the blood bag. The bag itself is very costly. Then the testing that you are doing on the blood. So you're doing 5 viral markers with advanced testing. You will be doing other cross-matching, grouping. So a lot of tests are done on the blood products. So cost of testing can be recovered from the patients, but not sell. That cannot be done. That is illegal.
Okay. Then can women donate blood while menstruating?
No, it is one of the deferral criteria. They can donate after their menstruation is over. Uh, During menstruation, it is avoided because they're already losing blood. So there are chances of hypovolemia and some hypertension. So transfusion transmitted the adverse donor reaction. The chances of adverse donor reaction increases in women during menstruation. So that is why it is one of the criteria that they are not allowed to donate while menstruating.
Okay. Then what is the shelf life of donated blood, and does donated blood ever go waste sometimes?
Okay, so the shelf life of whole blood is 35 to 42 days, depending on the anticoagulant that we use. So if we are using CPDA1, which is routinely used, it is 35 days. If we are using sagam is an additive, it acts as a nutrient. So we are adding additional nutrient to the blood component. So that will lead to increase in the shelf life to 42 days. So this is about whole blood and the red cells, PRPCs. Now we are also able to prepare components. So if we prepare the components, for the components, there are PRBCs, that is packed red blood cells, platelets, fresh frozen plasma, cryoprecipitate. So these components increase the shelf life of the blood a lot. For example, the fresh frozen plasma, the shelf life is 1 year. Platelets, the life is 5 days. So in most of the blood banks, in our blood bank also, we prepare components. So if it is platelets, it is used within 5 days. RBCs are used between 35 to 42 days. FFP, fresh frozen plasma, is used within 1 year. So we try not to waste them, but yes, occasionally in rare circumstances, it does happen, especially with platelets because they have a very short lifespan. So if the patient is not there and it is not issued in time, it gets wasted. So that is what happened during this COVID time because of the sudden lockdown. The short-lived blood products like platelets, they were wasted because they have only 5 days of life, and initial 5 days, everybody was so scared that nobody came out and visited hospitals. And then there was acute shortage because once it is expired, you have no means of getting more of it.
Yeah. So next question is, blood bags are stored in extreme cold. Do they not cause hypothermia on transfusion?
Okay, so blood is usually, the RBCs, they are stored at 2 to 6 degrees Celsius. And FFPs, they're in frozen state, but before issuing to the patient, we thaw them. So we have a bath which has the water of at a degree 37 degrees Celsius. In that, we keep the blood product and it is thawed. It comes to 37 degrees, then it is issued. The problem comes with RBCs usually because they are at 2 to 6 degrees Celsius. So they have to be transfused very, very, very slowly. The transfusion has to go through 2 to 4 hours. So only 1 or 2 ml goes in 1 or 2 minutes. Okay, so बहुत slow the transfusion is there. The rate of transfusion is very low. So by the time it enters, it comes to the body temperature. So most of the times it is not a problem. However, in cases of massive transfusion or in surgeries where there is active blood loss and blood has to be transfused very fast, in those cases, warmers are used. So they are the equipment which are present in the hospitals, which are used to warm the blood. At 37 degrees Celsius, the blood is kept in those warmers for some time and then immediately transfused to the patients. So hypothermia is one of the rare side effects which has to be noted, and it is on the clinician to take care that he's not transfusing it at a very fast rate so that the patient goes in hypothermia.
Okay, ma'am. So we're left with last two questions. One is, can we donate blood after vaccination like tetanus or rabies?
Okay, so vaccination is again another deferral criteria. Different vaccines have different deferral days. For example, anti-rabies vaccine, which is a live attenuated vaccine. So after this, the deferral period is 1 year. Okay. However, tetanus toxoid is a toxoid. It is just an extract from the tetanus bacteria. It's not a live or a dead bacteria. So it is just a toxoid. So here the deferral period is just 15 days. So different vaccines have different deferral period. If you have any vaccination, you should discuss it with your blood bank officer. The medical officer there has a complete list of what vaccination has to be deferred for what period of time, and he can guide you properly. But you should definitely discuss it with your blood bank officer before donation. And anti-rabies vaccine, 1 year, definitely.
Okay. So the last question is there any clinical reason why some countries deny blood donation from LGBT community?
Okay. No, it was initially in all countries, I would say. All the countries in the world, they had this thing that we should not take blood from this community. The reason was when HIV came into being in 1980s. So the most common community which was affected was this. So homosexuals were most commonly affected. So, and we had no means to test for this virus. Even with testing, initially the window period was very long. The tests were able to detect it after 6 months. So now with the advancement of testing, we know that our testing is strong. We have reduced the window period to 15 to 20 days. So we are more confident in our lab reports that whatever blood we are taking is safe and it is not going to be transmitted to a patient. So now they have removed this criteria, but it still holds true in India. It has not been removed from our criteria yet. So all over the world, this criteria is still followed. However, with knowledge, now people are raising their voices. So the government has to take this action and remove this criteria.
Okay, ma'am. So seems like we have covered up all questions. Thank you for solving all the queries, ma'am. I now hand over to her to wrap up.
Thank you so much, Sneha ma'am. It was an honor to have you, ma'am, here, Dr. Mayurika ma'am. And
thank you, Harsh.
I would like to thank IMA, MSN, and the organizers for the event, Dr. Rajneesh Raj, sir, State President, IMA, MSN, UP, and Dr. Rahul Anand, sir, State General Secretary, IMA, MSN, UP. And also thank you to all the candidates for giving their time for this event and making it a huge success. A video of this seminar will be put up on the YouTube of IMA MSN UP, and the certificate will be sent via email. Thank you so much, everyone. Thank you.
Thank you, ma'am.
Thank you, everyone. And I would like to again end with the note, become a blood donor today and donate blood. Thank you all.
Sure, ma'am. Thank you so much.
Thank you.